Hello, ladies and gentlemen. I am Valeria and this is the Off-Road Range. In the beginning of September, I received third-degree burns. I was hospitalized for 3 weeks and then recovered for another 3 weeks before I was able to return to the off-road range. I've seen enough cases much more serious than mine, and in addition to sympathy, empathy, help for my hospital room neighbors, in addition to the experience I gained, I had a lot of questions I decided to answer to. I asked doctors about treatment and studied various materials, and today I'd like to tell you more about burns in the first person, things I went through it. I will talk about the classification of burns, the structure of the skin, the first measures that need to be taken, treatment and transplantation. And in the next video, I will tell you about what happened to me and what treatment I was given. I will show you what my wounds look like, and I will tell you how I feel about it. So, first let's talk about what types of burns there are. But I'd like to make a note that I'm talking about burns of the skin only, and not of internal organs. For example, a mouth, a stomach, a throat, and so on. Based on the type of damage, the following types of burns are distinguished. Thermal. These burns occur as a result of exposure to high temperatures. This could be a hot object, an open flame, hot steam, liquid, and so on. Damage can be mild or serious, when deep tissues are affected. Radiation burns that are caused by exposure to various types of radiation. The most common burns are from sun rays. The reason is prolonged exposure to ultraviolet rays during peak solar activity. Many people have experienced this, especially those whose skin is not adapted to a sunny climate. Radiation burns also include burns caused by radioactive rays. Chemical burns occur when the body is exposed to various chemicals, acids, alkalis, gases. At home, this can be household chemicals, vinegar essence, car products, and so on. Electric burns occur as a result of exposure to electric current. They may appear when touching bare wires, operating faulty equipment, or lack of grounding. If the current is applied for a short period of time, a superficial burn occurs on the skin. Long-term exposure may cause damage to internal organs or inflammation of a person. I saw such cases in the hospital. An electric burn can also be caused by a lightning strike. And combined burns. When two or more factors combine, a combined burn can occur. How is our skin structured? Let's take a brief look. The skin has 3 main layers. Subcutaneous tissue, the innermost layer of the skin. It is mostly made of fat, connective tissues, larger blood vessels, and nerves. The dermis. It is connective tissue. This is the main structural framework of the skin. There are a lot of different elastic fibers and vessels here. The epidermis is the outermost skin layer. It is a multi-layered epithelium that continuously grows from stem cells in the basal layer and then peels off as it moves to the outer layer. In addition, the dermis and the epidermis are separated by another special layer, the basal cell layer. The stratum basale performs the following tasks. Separates different types of cells from each other. Unites certain cells. Regulates tissue regeneration, that is, the reproduction of stem cells that are attached to it. And it has a number of other functions. In fact, the structure of skin is much more complex, but I talk briefly. In the context of burns, we are concerned about regeneration. Regeneration is possible if there are stem cells to replenish cells lost due to injury. We have stem cells in 2 places. This is the basal cell layer, which contains cells that constantly regenerate minor superficial injuries, and this is the dermis. It contains stem cells that can differentiate in many ways. Certain cells in the dermis heal large, deep lesions and create a collagen framework for the dermis. Accordingly, the result of regeneration of a burn injury will greatly depend on how deeply the tissue was damaged and which stem cells remained alive for regeneration. So it is necessary to talk about the classification of burns by severity. When evaluating a burn injury, Doctors pay attention at two factors: the depth of the burn and the burn size, which is measured by the percent of total body surface area. Most countries have adopted a classification of 3 levels, but some countries have adopted a slightly more complex classification, and I will tell you about the second classification. Firstly, it divides the third-degree burn into 2 types, and secondly, it adds the 4th degree, complete charring. In any case, it is very advisable to understand what measures to take in case of a burn. So, a first-degree burn is classified as superficial. Only the upper layer of keratinized epithelium is affected, and all deep structures remain intact. The skin turns red due to vasodilation, local soreness and swelling appear. The skin regenerates itself and almost without scars. However, the pigmentation or texture of the skin may change. With a second-degree burn, the entire epidermis dies down to the basal cell layer. Bubbles filled with liquid content form on the surface of the burn. Essentially, inside is the liquid part of the blood with proteins and electrolytes, but without the formed elements of blood. Independent recovery is possible because the basal cell layer contains stem cells of epithelium origin, which are responsible for regeneration. The skin regenerates entirely due to the stem cells of the basal layer. Usually, the burn heals without scarring, since the cells of the basal layer completely restore the original epithelium. In third degree, the burn is deep enough to damage the stem cells that are responsible for repair. This is where the difference between grade 3A and 3B comes into play. With a third A degree burn, at least a little, but the viability of the dermis remains. The epidermis has survived only partially, but there is a chance that at least relatively functional skin will be restored. The deep layers of the dermis retain certain cells, including some stem cells. If many factors come together, for example, if there is no infection, if the vessels allow to regenerate, if nutrition is well balanced, if the immune system is strong enough, if there is no retraumatization, and so on, then the wound will heal and be covered with a scar which will be woven by living fibroblasts from collagen. This limits mobility and leaves a scar, but still it heals on its own. If the burn is a 3B degree, then everything is much worse. All the stem cells at the burn have died, and there is no surviving cells down to the fatty tissue. The skin was completely destroyed. Moreover, the wound will not heal on its own. From this stage and deeper lesions with charring, the patient needs skin grafting or plastic surgery of the wound edges. If such a burn is not treated, then most likely there will be no independent healing, and to put it very simply, the entire wound will be open. Muscles, fat and bones will stick out until an infection settles there and gangrene begins. Also, in some countries there is a 4th degree burn. The burn is so deep that not only skin but also the underlying tissues, fatty tissue, muscles, ligaments, bones are destroyed. The skin becomes charred. Muscles and even bones suffer. It is characterized by unbearable pain. The wound is covered with a dark gray scab due to tissue necrosis. Here, amputation is often needed. How are burns treated and what is the recovery speed? Very often, first and second degree burns heal on their own. In this case, the speed of recovery depends on the depth of the lesion. It can be from 2 days to 1 month, approximately. First, you need to stop the exposure to the damaging factor. If we talk about the temperature effect, for example, hot water, hot oven, and so on, then usually a person just withdraw a hand or dodge or move away from the source of heat. The affected area should be cooled with cold water immediately for at least 10-15 minutes to ensure that the temperature of the damaged tissues is reduced. Water has a high heat capacity and good thermal conductivity. It is necessary not only to cool the skin after burn from 100 degrees Celsius to 36 degrees, but to reduce the temperature significantly lower. This will greatly reduce pain and swelling by constricting the blood vessels. It can also significantly reduce the depth of the lesion and totally change the final result. The more stem cells survive, the greater the chance that everything will heal without scarring or complex surgery. But you shouldn't apply ice to the wound or pour ice water on the damaged area. In this case, tissue damage may become worse, since frostbite will be added to the burn. If there are no pieces of clothing or pieces of melted plastic stuck to the wound, if there is no injury that violates the integrity of the skin, then it will be enough to treat it with chlorhexidine or another antiseptic without alcohol, and then cover it with a sterile bandage. If the pain is severe, the person should be given an anesthetic to prevent pain shock. Second-degree burns cause pain, redness, and blisters, and are often painful. The injury may ooze or bleed. After healing, skin may be discolored. Before we begin providing first aid to the injured, make sure you are safe, especially if the burn is caused by electric current or a chemical substance. In case of a chemical burn, the wound should be washed to remove any remaining aggressive substance and, again, use cold water to reduce the temperature of the damaged area and stop the spread of the burn. In case of an electric burn, it is necessary to stop exposure of electricity. Then treat the wound with an antiseptic. If the damage is severe, call an ambulance immediately. Do not lubricate any burned area with oil, alcohol, egg white, sour cream, urine, and so on. All this can only worsen symptoms, increase the risk of complications, and seriously harm your health. If the damage is superficial but covers a large area, you should also urgently call an ambulance. Do not neglect qualified medical care, otherwise burn disease may develop. In case of extensive damage to the skin and mucous membranes, as well as damage to internal organs, you should also immediately call an ambulance or take the patient to the hospital yourself. There is no time to hesitate here. The sudden flow of blood to the affected skin can cause shock. The pressure in the main blood vessels drops as everything flows to the damaged areas of the skin. Deep burns are treated only in a hospital. As I said earlier, with a 38-degree burn, the vitality of the dermis remains at least a little, and recovery is possible on its own, albeit with scars. Patients wear special dressings and bandages. It is treated with special solutions, lotions, antibiotic ointments or creams to prevent or treat infections in patient. Doctors monitor healing, prevent infection, and wait for new, thin, tender skin to emerge. If necessary, dressings may need to be changed daily. This can be a painful process. If necessary, patients take painkillers. The healing process of a second and a third 8-degree burns can be accelerated and improved if hydrophilic agents with dexpanthenol, special foams, impregnated gauzes, antibiotic ointments, and special wound dressings are used. However, recovery from a third 8-degree burn takes up to a year, since external healing is only in appearance, and the internal layers take many more months to heal and the burn hurts for a long time. In the case of a third B-degree burn, the skin is completely destroyed and the wound will not heal on its own. Sometimes there is no pain because the nerve endings under the skin are destroyed. The patient needs a transplant. Autotransplantation is the use of your own skin which is taken with a special dermatome. A dermatome is a device that allows to cut off a layer of skin at a strictly specified depth. The surgery, done with general anesthesia, removes the injured skin and replaces it with healthy skin from an uninjured area of the body. There are a few types of skin grafts. Sheet grafts are usually applied to the face or hands for better cosmetic effect. Sheet graft uses the whole piece of skin without the holes in it. It gives a better cosmetic appearance but requires much more skin to cover a specific area. Mesh grafts are used for large wounds. When the donor skin is taken off the body, it shrinks. To stretch the donor skin, it is put through a special machine that makes small slits or holes in the skin. This stretched skin covers a larger area than an unmeshed sheet graft, but leaves a permanent mesh pattern similar to fishnet stockings. The wound heals as the area between the mesh and the holes fill in with new skin. Full thickness grafts are used for reconstruction of small areas that are prone to contracture, such as a hand or a chin. It consists of the full thick skin and shrink the least compared to other grafts. The area of the donor skin is similar to a 3A-degree burn. There is also a more advanced technology, the use of multipotent mesenchymal stem cells, MMSC. The most expensive, complex, and at the same time sometimes experimental is considered to be the cultivation of MMSCs from the patient's bone marrow in bioreactors with subsequent injection into burn areas. It improves infragment of autografts, close non-healing ulcers, and accelerate epithelialization of burn surfaces, avoiding infection, amputation, and additional operation for skin grafts. Instead of rough scars, almost normal skin is formed, which is elastic and functional. But even after leaving the hospital, treatment is not completed yet. It is necessary to treat the burn with care and to watch the redness and increased temperature. This may indicate infection. It is necessary to use various creams, ointments and lotions for healing, moisturizing and disinfection. It shouldn't be re-injured so as not to create a risk of ulceration. This is much more difficult to treat and takes longer, and in severe cases, repeated skin grafting operations may be required. The method of transplantation and healing of the donor skin area depends on the country, on the development of technology, on the level of the hospital, on the experience and professionalism of doctors, on the individual approach, on the availability of materials and medications, and of course on the finances of the patient. Ideally, fully functional, almost perfect skin can be obtained both at the burn place and at the place of the donor skin. In a bad case, functionality of the burn place will not be restored, and both the burn place and the place of the donor skin will have scars and hypertrophied scars. Dear viewer, I hope that a similar accident never happens to you or to anyone close to you, but I'd like you to know about the existence of such technologies. I ask you to like and share this video with your friends so that as many people as possible learn about first aid and the existence of such advanced technologies. They are used not only for burn conditions. By the way, I believe that human life and health should be valued equally all over the world, and the quality of medicine for any person should be provided at the possible highest level, regardless of how much money a person has in his pocket. I believe that both multi-billionaires and people of the least developed countries of the world must be provided with the same treatment, and it shouldn't be bought with money, privileges, or any advantages. And in general, there should be no charitable collections and donations, as well as attempts to prove to insurance companies that it is necessary to save a person's life. But for this, the approach to research and development and financing of medicine must be reconsidered. Dear viewer, please write in the comment what you think about the fact that richer people receive quality treatment and those who cannot pay have to become disabled for life. The deepest degree of burn is degree 4, which is also called full thickness burns. They are characterized with damaging not only all layers of the skin but also the underlying bones, muscles and tendons. Injured skin may turn white, black and gray. It may feel dry and leathery. Such burns are definitely treated with skin grafts. Patients with 4th degree burns often undergo multiple surgeries. And, as I said before, amputation is often necessary. I know a person who had 9 surgeries after being electrocuted and was hospitalized for 4 months. And there are people who had about 20 surgeries to save life. However, After a number of operations, the treatment is not complete yet, since the mobility of many affected parts of the body is very limited, and such people have to undergo a number of plastic surgeries to improve mobility in order to return to everyday life and more or less full functioning. Such patients can spend many weeks or even a month in intensive care, and doctors save their lives every day, and the patients themselves can remain unconscious for a long time. In such cases, full recovery doesn't occur, and rehabilitation to return to the highest possible standard of living can take years. Of course, after this, a person's life changes completely. And now I'd like to talk about new and experimental methods of treatment. In addition to autotransplantations, there is an alternative, the use of xenografts. This includes the skin of other animal species that has undergone special treatment. The most promising options now are pigs, which have always been traditionally close to us morphologically, and tilapia. Tilapia skin is very close in structure to human skin and has a similar collagen fiber structure. To use it as a wound covering, the skin is treated in special solutions to remove foreign cells, and only the connective tissue framework is left. Excellent adhesion to the wound surface and integration are observed. That is, a low percentage of rejection. A person's stem cells begin to colonize the xenograft and build new skin. In a good case, there is a possibility of a full reepithelialization. These technologies are still experimental and very expensive, but they look very promising. Dear viewer, I'd like to remind you that different countries have a different classification, a different assessment, different treatment methods, and different medications. And if you are interested in this topic, then I also recommend you to study the materials on wound care after burn injury, also because self-recovery after a burn plays a huge role. Be so kind and let me give you a very strong recommendation to take a first aid course or at least study this material on your own. This can greatly help you in the future and even save someone's life. Remember that hospitalization time is critical for burn patients. Be careful if you work with anything flammable. Safety precautions are very important. By the way, I talk about them in the video number 8. And in the end, I'd like to say that I have a dream to reach 10,000 subscribers by Christmas Eve. But the problem is that 97% of people watch my videos without subscribing, and this makes my dream extremely difficult. If you like my content, please like, subscribe to my channel and share my channel with your friends. I talk about my life, my difficulties, the development of my project, and I give only useful information. I will be grateful for your support. It was Valeria, the Off-Road Range. Wish you all the best and see you soon.